Welcome back again to this channel where we talk about the basic medical information making a big difference. Kindly consider to subscribe if you're new here, and if you're a returning subscriber, thank you so much for always coming back to check on this channel. My name is Rebecca Morangi. In the next few minutes, we are going to look at treatment of GERD. Treatment of GERD can be done in different ways. The first one being lifestyle adjustments or changes. Here, the healthcare provider can decide to advise the patient to look at the food somebody takes. Again, as an individual, because we looked at the causes, especially those who smoke, those who take alcohol, those who have a lot of weight. If they can look at on those factors, they can be able to manage this condition naturally. But sometimes non-prescription medicines can be used as a first-line treatment. What are these non-prescription medications? One is what we call antacids. Antacids, they come in different brands, and mostly they contain magnesium and aluminum. These, what they do, they neutralize the acid in the stomach. But these ones, they cannot be used for a long time because of the side effects. What are the side effects? There are those who get diarrhea, especially for the magnesium containing antacids. You have what we call nausea and vomiting, constipation, headache, especially for those who are above 65 years. You have gas or flatulency. So you cannot use these antacids for a long time because of these side effects. Another non-prescription medication, we call them over-the-counter, because you can easily walk to a pharmacy and get them, is what we call alliginates. Alliginates, it's a naturally occurring sugar derived from what we call seaweed. How does it work? It works by blocking the acid reflux. What does it do? It blocks the acid by floating on top of the acid, creating a physical barrier between the esophagus and the acid. If you can have a look on this, we have the esophagus, we have the stomach, and then you can see the acid content going up. Now, to prevent this from happening, when you take alliginates, it forms this barrier. You can see the black barrier that is just for demonstrating. Now, to prevent the acid from moving up through the esophagus and outside. So that is how alliginates works. But sometimes when you take these over-the-counter medications and you have done lifestyle adjustments, maybe they have not worked for you, another step is to take prescription medications which are actually prescribed by a healthcare provider. Let's have a look at them. One is what we call histamine receptor antagonists, or what we call H2 blockers. How do they work? They work by blocking histamine production, which stimulates the cells in your stomach lining to make hydrochloric acid. Another thing, you may take them frequently than antacids. Another class of prescription medication is what we call proton pump inhibitors, or you can call them the PPIs. These are strong acid blockers than H2 blockers. They are given when you have signs of tissue damage because they promote healing of the tissues. Actually, they are 90% effective of reducing acid reflux. Some of the examples we have omeprazole, lansoprazole, and pantoprazole. So those are some of the medications used to treat this GERD. And these PPIs, actually, they come in a variety of brands in the market, and they have got different strengths because we have young children and we have adults with these conditions, so they have different strengths. So the strength will depend on the age group of the patient. Now, what if you have done lifestyle modifications, you have taken over-the-counter medications, you have taken prescription medications, and they are not working? Sometimes they may fail to work, but other people prefer not to take medications and they go for another way of treatment. So another treatment option is what we call surgery. How is it done? Let's move and look at how surgery is being done. We have said surgery can be done for those people who have used medications and they have not worked, or they don't want to use medication for long. We are going to look at fundoplication. The name fundoplication comes from the word fundus. Fundus is the top of the stomach. You can see this top part here. It's called the fundus. Now, this surgery is done, this is the fundus, is tightened, wrapped between the esophagus and the lower sphincter muscle by tightening it. You can see this diagram, how it's going. So this upper part is wrapped around, and then some stitches are done. You can see here how the stitches have been done. After wrapping it around, it's stitched here to tighten this part here within the esophagus and the top of your stomach where we have the lower sphincter muscles. By doing that, it can be able to prevent this acid reflux. In this surgery, we have two ways of doing it, either by complete fundoplication or partial. Partial is what we call Toupet fundoplication, or complete. The ones have demonstrated here is what we call complete fundoplication. We have another way of doing this by doing what we call LinIX device. How is it done? LinIX device is a ring of thin magnetic pits wrapped around the junction of the stomach and the esophagus. This magnetic attraction in the pits is strong enough to keep the junction closed, but weak enough to allow food to pass, because food must go through the esophagus into the stomach, but preventing the acid reflux. That is why these magnetic pits are used. Now let us look on the second demonstration here. Here we can see the esophagus, the stomach, and the acid. This is the acid refluxing back through the esophagus. Now what it's done, this LinIX device is put here, which tightens this part and preventing acid from refluxing back through the esophagus. Now you can see here the magnetic device opening to allow the food content. Remember, we said it's strong enough to prevent acid from refluxing but weak enough to allow food to move to the stomach. These are the ways of treating GERD by the way of surgery. Up to this point, I believe you have gotten how GERD is being treated. We started from looking at lifestyle modifications. We came at non-prescription medication, that is over the counter, we call them OTC. We have looked at prescription medication, and then lastly we have checked on surgery for those who don't want to use medication for long, or those who medications have not worked for them. Thank you so much for always checking on this channel. Kindly, if the video resonates with you, kindly share the link. By sharing the link shows that you are considerate, and let's get the information. Information is power. Even if you don't have the condition, you can help your loved one. Let's keep on learning. In the next video, we are going to look at, are there ways we can manage these conditions without using medications? Are there natural ways we can do away with medications or surgery? If we can't really get complete treatment, how can we minimize these symptoms? Thank you so much, and let's meet in the next video. Bye bye.